My name is Gwen Jackson, and I'll be completing head-to-toe assessment of my patient here, Deborah Relaford. She's a good friend of mine, and she has agreed to be my patient. As with any procedure or assessment that you start on a patient, you will first explain to them what you're doing and introduce yourself. So, hi Deborah, my name is Gwen Jackson. I'm a registered nurse, and I'll be doing a head-to-toe assessment. Is that okay?
That's fine.
The head-to-toe assessments is a assessment tool that we use to kind of make sure everything is normal with your body, non-invasive. Is that okay?
That's fine.
All right. So I've explained to my patient what I'm going to do. I've introduced myself. Then I will wash my hands. I always perform proper hand washing and making sure that you don't have any germs. Decreases the infection control rate in your facility. Will be proud for you. So anyways, needless to say, with my assessment, I'm going to start off first by obtaining vital signs. This will be a blood pressure, a pulse, respirations, temperature. Pressure, pulse, temperature, respiration. And if I have a pulse ox machine, I will obtain a pulse ox and as well as ask the patient, are there any pain? So I've obtained my vital signs from my patient. Are you having any pain or discomfort?
No.
So the pain for my patient will be a 0 out of 10 because she verbalizes no pain. I first start my assessment, just a general look over, and I'm basically looking for abnormalities. I will work at my head, start at the head and work my way down, and I'm looking at Deborah's face and everything is symmetrical. Her eyes are in alignment. She has no bruising, no rash. Lips are symmetrical. She's smiling, so her lips are symmetrical and her nose is intact. I then will look at her scalp, and her hair is evenly dispersed, and just by touching, I don't feel any lesions or anything like that. And of course, if this was a real situation with a real patient, I would have gloves on to protect myself and the patient. But her hair is evenly dispersed, and there's no lesions or anything. In regards to her face, all she have is some raised moles, which is not abnormal. So I've done her head. Then I will go down to her neck and kind of look just to make sure that there's no masses or no growths. Now, in that observation, since I felt, I will palpate, and you always come from behind. I will palpate her trachea and her thyroid. And they're both within normal limits, no deviation, and they're symmetrical, and it doesn't feel swollen or anything like that. So we've assessed her trachea, and looking at her ears. Everything looks fine with her ears, and I can get the otoscope and cut it on and look in her ears. And I can visualize her eardrum and the cone of light. There's no fluid or free air or anything in her ears, and you do that on both sides. Looks good. So I've listened to her ears. I've noted that there are no abnormalities in her ears. Since we're still on the head, I'm going to look at her eyes, and I'll get the ophthalmoscope and look at her eyes. Get this on here. And basically I'm looking for fundus, and basically to determine that there's no retinal hemorrhaging or anything. I'm going to first do a pupillary response with my pen light. And her pupils did constrict down from a 4 to a 3, so that's within normal limits. Pupils are equally round and reactive to light and accommodation. I'm going to take the otoscope, and now you can tell. And of course, when I'm doing this, the room would be dim. I am aware, but for Pete's sake, time's sake, it's not done now, but I am aware. And you're basically looking. And I am also aware that when I do that, I work on the side. So if I am looking at her right eye, I will work from the right eye. And if I'm looking at the left eye, I will work from the left side. So that's that. I did her ears. Her nose is symmetrical. I can go by feeling the sinuses. Are you feeling any pressure or any tenderness?
No.
Okay. So her maxillary sinuses are intact without any swelling. Palpate the sun. Okay, inspecting the mouth. I'm gonna look at her sinuses and make sure there are no growths in her mouth. Make your tongue out, say uvula present, tonsils are present, no redness, swelling, or drainage, no sinus drainage. I'm gonna look in her nose and note the same. Look in her nose and everything is intact. So I've done pretty much the upper portion of her assessment. I've looked at her ears, I've looked at her eyes, everything's symmetrical, hair even dispersed. We'll move down to the pharynx, which is intact. I'm going to defer the breast, but I will explain the breast. Anytime you're doing a breast exam, of course, you have the patient raise their hands over their head and basically rotate out, outer to inner, focusing on the tail right here where there are some lymph nodes at. It's best to do it in the shower for a self-examination, but of course the doctor can do it, and it's usually done when you have your pap smear. So that's the inspection of the breast. You first look before you palpate or touch anything. You look, you note the if there's a texture change, if there's some obvious bruising, and then of course you would palpate. The axillary nose, I did mention that with the breast exam, that you feel for the tail with the axillary nose. Now we'll be moving to the lung sounds, and of course I would look at her chest. If she was unclothed, I would look for equal expansion and symmetry on both sides, and from what I can observe now, take a deep breath for me, Deborah. Everything is symmetrical in looking. So I am now going to listen to her lungs. Take a deep breath. When you're listening to the lungs, you listen for one complete cycle, which is inspiratory and expiratory, and you move it from here to here because you're comparing sides, listening for clear, even airflow. Deep breath. Sounds good. Moving down on this side, deep breath. Let it out. And then comparing and going to this side, deep breath. Let it out. And then I will come along here on the side of one of women. We listen towards the side because of the breast is kind of hard to hear, so you'll come towards the side. Because you have two lobes on the left side, you're going to listen to these two spots here, but then there are three sides on the right side. Then that's the anterior auscultation of the lungs. Then you'll listen from the back side, which is posterior, and you'll start on one side for a complete cycle, inspiratory and expiratory, going from side to side. And you have about 5 times on each side to make sure that you listen to all the lobes of the lung. After I've looked, I've listened, I'm going to percuss, and basically when I'm percussing, I want hypersonus, which would indicate that there's no masses. So that's with that. I'm now going to look at her fingernails, and there's no clubbing of her fingernails. I'm going to test her capillary refill. Her capillary refill is brisk, so she's got good circulation, and you can do this to your hands and the feet, which would indicate proper circulation to those areas. I would now check her pulses, doing first radial, then you do the brachial, then you do the femoral, then you do the popliteal, the posterior tibial, and the dorsalis pedis. But for time's sake, I won't check each one of them. But in a description of her left radial pulse, it's bounding, good strong rate, and it's regular. So that would be the pulse check. In doing the carotid pulses, which is a circulatory system check, you basically take your 2 fingers and you feel right here, noting the rate and the rhythm and whether it's bounding. And when you check the carotid pulses, of course, you stay on the side that you're checking, but you do one at a time. You never check both of the carotid pulses at the same time because you're applying pressure, and that applying of the pressure could inhibit blood flow to the brain. I'm going to now listen to the lungs. Let me get my stethoscope and listen. I mean, not her lungs, her heart. Now, when you listen to cardiac sounds, you'll have to use the bell of the diaphragm because it'll give you better sound. Left second intercostal pace. Now, when I'm listening, of course, I am listening for the rate, for the rhythm, and noting that S1 and S2 is present, and you'll do that both with the bell and the diaphragm of the stethoscope. Once I have did a cardiac assessment, I will then go to the abdomen, and of course the abdomen is divided into 4 quadrants: left upper, left lower, right upper, and right lower. I will listen to lung bowel sounds in each of those areas. Once I listen, look, listen, then I will feel, which I will percuss and then palpate. So, of course, you percuss, and when you percuss, you use your hand and you're kind of tapping and listening for a dull sound. Then you'll palpate, of course, in each quadrant, feeling for that. Since she's not laying flat, I can't do that, but I did want to mention that. Now, during the assessment, you'll be talking to your patient to note their alertness. And because Deborah's sitting upright and I have spoken with her, I know that she's alert. Deborah, can you tell me what today is? The month?
November.
November. So she's alert to time. Can you tell me your complete last name, your full name?
Deborah J. Relaford.
So she's alert to person. And can you tell me what state we're in?
Arkansas.
So she's alert and oriented times 3. I will now go through my cranial nerves. The first one being the olfactory, and with the sense of smell, of course. Deborah, can you tell me what this is?
Vanilla.
It is. So her olfactory nerve is intact. Her optic nerve, which is pupillary reaction, is intact because I did listen to her. I did look at her pupils. If I had a Snellen chart, I would do visual acuity and noting that if corrective lenses are in use. Oculomotor is pupillary reaction and extraocular movement. So I'm going to have Deborah follow my hand. And her extraocular movement is tact. Cranial nerve number 4, which is trochlear, is extraocular movement as well. Number 6 is abductions, which is extraocular movement. I skipped 5, which is trigeminal, and that's the trigeminal nerve, 3 nerves. And because she's talked with me, she does have jaw movement. I will note her sensation to a soft or a pricking motion. And when you do this one, you'll do it on both sides because the trigeminal nerve does run on the left and the right side. Is that soft or firm?
Do it again.
What's that?
Pricking.
Okay, that's a pinprick. So that she does have the ability to differentiate a pricking motion versus a soft one. Cranial nerve number 7, which is the facial. His facial movement is her lips, which hers is intact. Raising the brows is another one with the facial. Of course, then there's cranial nerve number 8, which is acoustic and the ability to hear. And Deborah has been able to hear me because I have talked with her. With the acoustic, you can do the rhyme test, which is when you take the tuning fork and basically tap the tuning fork and sit it here. I'm not going to physically do the test. I'm just going to mention it. I've noted to my instructor that the longer my videos are, it's difficult for me to upload them. So I may not perform a test, but I will mention it. Or the rhyme test, which is a test of vibration. Acoustic glossopharyngeal is cranial nerve number 9, and that's with your tongue and licking out your tongue and your gag reflex and your swallowing. Cranial nerve number 10 is the vagus nerve, and it's voice and speech in your gag. Cranial nerve number 11 is your spinal accessory, and this is your shoulder movement and your ability to move your shoulders. So lift your shoulders up for me. Last but not least, cranial nerve number 12 is hypoglossal, which is your tongue and your symmetry of your tongue. So I went over the cranial nerves. Her joints. I haven't did her joints. During assessment, you're noting flexion, extension, and rotation of the joints and her ability to extend her arm here and flex. And I will do this to each one of her joints: elbow, the wrist, and then her hands and her shoulder, a rotation. And we'll do that on both sides. When you're doing an assessment of joints, of course, you're going to look at them, feeling for any redness, noting if there's any inflammation or there's pain with movement. You do that with all the joints: shoulder, elbow, hands, and then her hip, and we'll do that once she get up. But rotating her hip out and looking at her knees, arthritis, common inflammation of the joint. With that will be some redness to the joint and some swelling, as well as pain, discomfort, and the inability to move the joint appropriately. So you do the hips. You flex and extend the knee. You'll go down to the feet and rotate your foot, flexion and extension of your foot, range of motion. Then, of course, upon observation, your muscles. You will test their muscle strength. Deborah, squeeze my hands. And her grips bilaterally are equally, and they're good and strong. So we got the muscle strength. I will then test her reflexes, of course, the brachial radius. Okay, we'll do the knee since she put her knee up. Go right here. You okay, hon? And basically, you just kind of tap the knee, and she did jerk. So her popliteal is intact. We did have a response. You do the brachial. Let me come on this side for this one. The brachial radius, basically with her hands on her lap and her arms in pronation, you basically strike the radius. And she did have some flexion with that. I need to do her. I didn't do her lymph nodes. So, in doing the lymph nodes, you start with the preocular front, postocular, going towards the base of the skull for the occipital, coming down to the mandible of the neck for the tonsillar, coming over here, submental, chin. Then going down the sides of the neck, that's the superficial cervical. And then towards right here, the shoulder blades, the posterior cervical. And then going a little deep, you will have the deep cervical. And in the shoulders, the supraclavicular at the shoulders. You wouldn't specifically have your patient walk, but testing their gait, and that's something that you can do perhaps as they're leaving when you're noting the assessment. But I'm going to have Deborah to stand up for me and walk, and basically do a heel to toe motion. Camera, girl, walk heel to toe, heel to toe. And as your patient is standing up, I will then inspect her spine. And I'm looking for any curvature or any abnormalities of her spine. And you can do that by feeling the spine. You can have her kind of bend over a little bit. Testing for scoliosis, so we've tested her spine and looking for things like that. I think that's the end of my assessment. I've done a complete assessment. I have. That's the end of my assessment. Have a great day. Bye.